the American Academy of Family Physicians and the American College of Physicians, have both recommended, as well as other societies have recommended, that the first approach to the direct management of insomnia in older individuals should really be behavioral modification and cognitive behavioral therapy. And this is in recognition of two facts. Number one, the cognitive behavioral therapy is effective, works well, and has very, very few side effects. And its effects are more long-lasting than pharmacotherapy. That's number one. Number two, we recognize now more and more that pharmacotherapy can have significant side effects in the elderly, who tend to be more fragile, more vulnerable to the effects of medications. Now, that's not to say that pharmacotherapy should be avoided. However, the first approach to the direct management of insomnia really should be cognitive behavioral therapy. So, cognitive behavioral therapy has a number of advantages. Obviously, it does not introduce the metabolic and side effect burden of medications. Number two, it tends to have a longer acting effect. So many months and even years after the discontinuation of cognitive behavioral therapy, we see evidence of continued efficacy with insomnia. It still works up to 1 or 2 years after therapy has been completed. Whereas this is not something which we see with hypnotic medications or sleeping pills. They stop working very quickly after discontinuing the medication. Number three, cognitive behavioral therapy is especially in older individuals, does not introduce many of the cost risks associated with medications, and cost factors are significant in older individuals. On the other side of the equation, the disadvantages of cognitive behavioral therapy are that the number of therapists that are available and trained well to do the therapy are few and far between, unfortunately. And some of them don't have adequate insurance coverage. So the other disadvantage of CBT, or cognitive behavioral therapy, is that it tends to not work quite as quickly as pharmacotherapy. So if there are individuals who need rapid treatment, that may be the less appropriate approach. Finally, CBT is much more appropriate in individuals who have multiple medical conditions and who have multiple drugs on board, because the data clearly show that these folks are better treated and the treatments are more effective when CBT is the choice over pharmacotherapy.